had?
I wish I had more support from my parents, especially my mom. She's an immigrant. She came here when she was, I think, 9 years old from Jamaica. And so to her, mental health for a very long time didn't exist to her until she saw how it like affected me so detrimentally. And she realized like, oh, this is real. You're not just making this up. Like, this is a real thing. And so I just wish that my parents were more supportive. I mean, she is now that she realizes the effects of different things, but I just, yeah.
Definitely 100% agree, because the exact same thing. Like, my mom immigrated here like in 2007 when I was born to have me, and it wasn't until I would say like freshman year when she got a call from the school that she was like, oh, like, this is real, like, you need help. And just that whole journey, even like 2 years later when I ended up being in treatment, she was just like, oh, like, is this really what you need? And it's like everyone is like telling her like, this is what like your child needs. And it's just like that difference like that my mom had in her childhood and her relationship with mental health really played a role in how she treated mental health towards me. And it wasn't until, like you said, like once my mom realized how detrimental it affected me, that's when she started to take it more seriously. And also in schools, when I attended the Black Youth Suicide Prevention Policy Academy in Maryland over the summer, they had a student panel, and someone mentioned that like they wished that people wouldn't be so quick to send like a child to the hospital like when they say that they're suicidal. Like, I understand that, like, yes, like that's something very serious, but there's also like passive thoughts. Like, not all thoughts are active. So I wish that like more faculty in schools would take the approach of like actually like sitting down with the student, like talking them through
like more mental health training.
Exactly, rather than just like straight like sending you to the hospital or calling your parents, because that's not helpful for anyone.
They're not good at processing with I think a lot of schools are, their system of processing mental health issues with students is terrible.
No, yeah, I totally agree with both of you guys. I think it makes an even bigger disconnect because that's how the process is, and it makes kids scared to go to anybody for help, because even sometimes friends, like I know that I have had to go to a teacher because I was worried about one of my friends, and like I didn't know what was gonna happen after that, but it's so scary to like not know if like they're gonna be sent off right away, if they're gonna get like a talking to, or if it's just not gonna come up to anything. It's really, yeah.
I think what really scares me the most is not more about the friends or like the teachers aspect, because I do understand teachers are mandated reporters and they must report something if they see or hear something. However, to me it's more of the hospital aspect, because the stigma surrounding mental hospitals and asylums, I just kind of feel like in the United States is not something that I would want my child or my friend or even me personally to go to. If from what I'm hearing from the internet and all those from all sources, that the hospital is not really treating you, it's just containing you.
Yeah.
So
I've had situations where I think I've been to mental health hospitals 5 times in my life, and I've had to stay for like weeks on end. It's really not what people think it is. Like, it's not like, oh, you just go to the mental hospital and you get better and you come out and everything's...
That's not what it is.
Yeah, no, and considering the fact that I've been back so many times, like that goes to show that it's not this like easy fix that like teachers think that it is, to just send kids off to a mental hospital.
That's so true.
Like, you get what I'm saying? It's not just like...
Yeah, and even like the same thing with like treatment facilities. It's like they're really just there to like kind of fix you on the outside, and they don't actually address like what the root causes are. So I feel like overall, like the way us as a society treat mental health, both like in and outside of like the hospital, treatment facilities, whatever it may be, whether it's in schools, at home, whatever, like we just treat mental health so poorly, and nothing is getting
It's so short term. It's very like thinking, oh, okay, how is this person gonna feel or be doing in like a month? Instead of like, this is something like, when people get diagnosed with certain mental illnesses, some of them are lifelong. Like me personally, I've had ADHD, anxiety, and depression for a very long time, since I was probably like 6. I think depression was more when I was like 12, I got diagnosed with that, but I think people don't understand that those things don't go away. like it's something that I'm gonna have to deal with and figure out different strategies and ways to cope.
Especially if like you're misdiagnosed or undiagnosed, like there's no way of getting help because you don't know what type of help you need, and it's so difficult for everybody to go through.
To say more about that, that's exactly why I kind of feel like we need people that have gone through those types of perspectives and roles to be in the education, in the healthcare, and just to facilitate the process of like, okay, like I understand where you're coming from, I hear you, I see you.
To relate,
like,
because a lot of
exactly.
these teachers can't relate to some,
Yeah.
especially the white teachers. Like when I am talking to them about like anything racial and they try and come in with that, oh yeah, that like white sympathy, just like it's almost irritating.
And it's so hard too because they just grew up so different from us, and then it's also like the different generations, like they have learned so much different than like what we're learning, and like social media and like phones and all this extra stuff. It's like it's so new, and like we don't know how to navigate it, even though we think that we do.
And because they haven't gone through it, you just get seen as like damaged goods, which brings us back to just getting sent off like as soon as something comes up.